Today's NCLEX-style case study comes straight from cardiac rehab basics. We're talking myocardial infarction recovery and the surprisingly specific vital sign every nurse should highlight during discharge education. Picture this. Your patient just got through a hospital stay for an MI. They're stable, they're home, and now they're trying to build back strength. You advise walking, starting short distances, gradually increasing the effort. So what's the vital sign that should guide that progression? Pause and think. I'll give you a few seconds. Go ahead. Mentally scan the options. Pulse rate, blood pressure, temperature, respiratory rate. If you locked in pulse rate, you nailed it. That's the key sign of cardiac demand. And here's the clinical kicker. Pulse rate should not rise more than 25 BPM above baseline during exertion. If it does, the client should decrease activity. Let's talk through the rest. Blood pressure? Expected to rise, but not your go-to metric here. Temperature? Might spike slightly, mostly irrelevant in this context. Respiratory rate? Also reactive, but not a reliable guide for exertion. Why is pulse more actionable in the home setting? What does it tell us about the heart's workload? Educating your client means giving them tools they'll actually use. Teach them to check their radial pulse. Encourage short walks and rest breaks. Empower them to notice patterns without fear. Think of how you'd explain this to a client. If your pulse jumps more than 25 beats, slow down, hydrate, rest. That's cardiac rehab in plain language. Let's close with the ADD-PIE framework, nurse to nurse. Assess baseline vitals. Diagnose tolerance. Plan a gradual increase. Implement pulse tracking. Evaluate for greater than 25 BPM spike. Rewind this case in your mind. Can you coach it the same way? Would your patient retain what you just taught them? If you're loving these breakdowns, hit subscribe, because critical thinking is a muscle, and I'm here to help you train it. More NCLEX-style walkthroughs coming soon. Subscribe and like for more prep and nursing review.